This week, doctors are seeing an uptick in flu cases. Take a look at this map. The CDC says Tennessee is one of 7 states with a high level of flu transmission, and you can see that on your screen in red. 10 News reporter Grace King brings us the very latest advice from health experts.
If you're starting to feel sick after traveling for the holidays, there's a few things you should do.
By all means, get tested for COVID, and think also about getting tested for influenza, because influenza is waking up out there too.
Dr. William Schaffner of Vanderbilt University Medical Center says they're beginning to treat more patients for flu.
It's not a big surge yet, but it's still very early in the influenza season. We're concerned that we will have a surge of COVID and a surge of flu, more or less at the same time.
To prevent that surge, internal medicine doctor Michael Green says there's a few things you can do.
First is our behavior, what we choose to do with our lives. Secondly, we can get tested.
Third, vaccinations and booster shots are becoming increasingly important.
So usually somewhere between 3, 6 months, 9 months, somewhere in that range, you need some help. Your body needs to be reminded how to fight COVID.
If you do get sick, there are treatments that can keep you out of the hospital.
There's some antibodies that can help once you've been exposed or already starting getting sick. And then lastly, there's a new addition of an oral medication that could potentially help once you already are infected.
That was Grace King reporting. Right now, about 16,000 people a week are getting tested for COVID-19 in the state of Tennessee. For perspective, that's about half as many tests as we saw during the September surge.